David Greene, founder and CEO of R3 Stem Cell Pakistan. What we're talking about today is knee arthritis. And it's interesting because, so many people as we get older, 50s, even the 40s, 50s, 60s, 70s, 80s, suffer from knee arthritis. It's one of these things that, when it starts to occur, it becomes almost like this, the proverbial pebble in your shoe, which just won't go away. You have to wake up with it every day and then deal with it throughout the day. And it prohibits a lot of people from doing activities that they used to enjoy and love. Whether that's just walking around the block with your loved one, maybe playing a recreational activity. I guess here it's mostly cricket and soccer and whatever that may be. And when you look at the traditional treatments for knee arthritis, they haven't changed much in the last 50 years. And that's unfortunate, because with new technology, we should be able to do better. And now we are with stem cell therapy. But let me just touch on what the older treatments, the traditional treatments have been. First of all, you have a cane or a knee brace, maybe some anti-inflammatory medications like Advil, ibuprofen, possibly some pain medications like narcotics when times get bad, and good old steroid injections. Steroid injections have been around since like the 1960s. We have like 50, 60 years of experience with them, and they're not great, but they've been around so long that insurance companies pay for them, doctors give them, like Skittles all the time. And they only provide on average 2, maybe 3 weeks of pain relief. And that's a tragedy, because people deserve better than that. And in addition, steroids don't give any other benefit. They don't help restore cartilage. They don't help build back up ligament or tendon tissue. It just doesn't happen. So with stem cell therapy, we are doing wonderful things. It's much, much better of an opportunity. Why? Well, let me explain. I look at stem cell therapy for, say, knee arthritis as bridging the gap between those non-operative conservative treatments back that we've been doing for many decades and knee replacement. So for so long, we haven't really had much in between. The newest thing has been those gel injections, hyaluronic acid, which maybe last for about 3 months. But nothing that regenerates cartilage to a significant extent or provides pain relief for well over a year. Well, stem cell therapy is doing that. Our centers around the world have done over, I think, about 7,000 knee injections alone. It's the most common indication for the treatment, and the results have been close to 90% effective. It works fantastic. Usually pain relief starts in about 2 weeks, and it continues to get better for months and months, and then it usually baselines off after 6 to 8 months, and then it usually continues anywhere from, on the low end, typically 1 year, upwards of, we have plenty of patients who had injections 7 years ago. So it's one of the longer term investments that you can make in your health for arthritis. Now, this isn't just for degenerative arthritis, which is called osteoarthritis. It also works really well for autoimmune types of things like rheumatoid arthritis, lupus, psoriasis, gout arthritis, as well as post-traumatic arthritis. How many people, including myself, have knee pain from injuries that were sustained back in high school or college, from either being a weekend warrior, or we treat plenty of high-level athletes after either during their careers or after their careers, to help them get back to doing the things that they love. I had a Super Bowl football player that we treated in Chicago in the United States years ago, and he was in the Super Bowl several times. Big guy, 6'7", still in fantastic health. And he said that the main thing that he loved now, at 67 years of age with his knee pain, was getting the relief and being able to get up out of bed and walk on the hardwood floor to the bathroom in the morning and not have any pain. And for him, that told him it was going to be a good day, okay? So don't think that you have to be one of those who's going to go out and run a marathon or something like that. All too often we hear stories like that, or older ladies say, I just want to be able to go to the grocery store again and be able to walk, through and just do my activities of daily living. So how do the stem cells work for knee arthritis? Well, it's given as a direct injection into the affected knee, often both, okay? We give a very high quality stem cell biologic. We know how important that is. We've been doing this for a decade now, and it's very, very important to use a first-rate biologic. They come from our lab in the United States, which is regulated by the FDA. The quality assurance standards are very, very high, and they get tested for every possible disease condition the FDA could think of. As a huge list. And it gets, the tissue is from consenting donors after a scheduled C-section, and it's the umbilical cord tissue that has amazing amounts of stem cells and other regenerative cells and proteins like exosomes, cytokines, growth factors. I call it a virtual orchestra of regenerative elements. At any rate, the biologic comes from the US. We bring it over on dry ice so it stays cryogenically frozen. Before a procedure, it only takes about 20 minutes to thaw out the biologic, and then it gets injected into the affected knee, or both knees, like I said. And how does it then work? Well, I look at it as a change of cell formation ratios. So let me explain. It doesn't matter whether you're 20 years old or 80 years old. Throughout life, we all make cartilage at the same rate, okay? That doesn't change. What does change is the rate at which we lose cartilage as we get older. So if the rate of cartilage formation doesn't change, but the rate of loss continues to go up, you end up with this deficit, and that's how degenerative osteoarthritis occurs, okay? So you're losing cartilage faster than you're making it. With a stem cell procedure, we are able to help you make more cartilage and lose less. So we flip that ratio of making more cartilage and losing less to put it back into the patient's favor, and that is a tremendous way to relieve pain, get people back, like I said, doing the things that they've been missing and that they love. And it's not just for 2 to 3 weeks like a steroid injection. We're talking, like I said, at least a year. We've seen people 7 years in who are doing fantastic. They've avoided a knee replacement. They've avoided other risky types of surgeries, avoided the need for narcotic pain medications. So it's been really a game changer in the non-operative treatment for knee arthritis. Now, one thing I wanted to mention that a lot of people don't realize is, let's say you decide, you go to a doctor here in Pakistan, China, wherever, and you make the decision, the doctor says, you know what, all I have to offer you is a knee replacement because you have significant arthritis. Might be that it's hard to see a joint space. You make that decision with the doctor, you undergo the knee replacement. The question then is, how many people are unhappy with a knee replacement? And you have to take in mind that it can't be reversed. That's a definite, done, irreversible. The bridge has been burned, so to speak. The answer might be surprising to you. A recent study, there's been several of them, British Medical Journal, Orthopedics Today reported on one a couple years ago, and over 35% of patients in these studies say that they have significant pain 1 year after their knee replacement. And that means they're not happy, because that pain often just doesn't go away. Even though there's no joint remaining, it's been replaced with plastic and metal. So that's an irreversible issue. And so many patients come to our seminars and they say, I had a knee replacement, I don't like it, it's painful, I really don't want to get the other side done. Stem cell therapy is a tremendous option for a patient to help avoid a knee replacement. Now, one last question. What happens if you've had a knee replacement, you're still having pain, would you be a candidate for a stem cell therapy for knee arthritis? The answer is yes, but not in the way you might think. Injecting stem cells into a knee that's already been replaced is not going to do anything. But the pain is coming from somewhere, so most likely it's coming from some of the soft tissues around the knee, or it could be coming from the hip or the low back, some arthritis issues there. So that's something that our doctors are very good at evaluating and figuring out what is generating that pain post-knee replacement. So we can help you with those. So here in Pakistan, we offer stem cell therapy for all types of knee arthritis, tendonitis, bursitis, any types of pain that you're experiencing. The same treatments that we offer in the United States, we offer here. The results have been absolutely fantastic. Over 9 out of 10 patients are really, really happy with their results a year after a procedure. They would recommend it to their friends and family or have the procedure done again. So whether it's a sports injury or degenerative arthritis or any type of inflammatory arthritis, maybe an autoimmune condition, we can help you with those issues, help you get off some of the medications you've been taking, help you avoid surgery. So here in Pakistan, we have locations in Islamabad and Lahore. Others are coming soon. The phone number to call to set up your consultation is 051-889-6711. Thank you.